Everyone, welcome to another video. So in today's video we'll be looking at sickle cell anemia crisis. So recently, June 19th was World Sickle Cell Day, a day where we are taught to raise awareness for this condition known as sickle cell anemia. So I've decided to do this video as a way to raise awareness too, in my own way. So basically, this sickle cell anemia crisis, it refers to sudden episodes of pain and other symptoms that happen in people with sickle cell anemia. And sickle cell anemia is basically a genetic blood disorder where red blood cells are abnormally shaped like a crescent or sickle instead of round and flexible, hence the name sickle cell. So these sickled cells they can get stuck in small blood vessels, blocking blood flow and causing pain, organ damage, and complications. So the crisis can vary in intensity, it can vary in frequency, it can vary in duration, and it may even reach the point of being life-threatening. So the red blood cells, they normally have a round, flexible shape that usually allows them to move easily through blood vessels and carry oxygen throughout the body using a protein called hemoglobin. So in cases of sickle cell anemia, the hemoglobin is abnormal, and this is called sickle hemoglobin, this abnormal hemoglobin, and it causes the red blood cells to change shape under stress or low oxygen. So these sickled cells, they are rigid, they are sticky, and they are short-lived. So they survive only like 10 to 20 days instead of the normal 120 days that the red blood cells, that's the lifespan of the red blood cells. With sickled cells, they only last 10 to 20 days. So as a result, the person has chronic anemia, that is low red blood cell count, and episodes where the sickled cells block blood vessels, leading to this sickle cell anemia crisis. So for the pathophysiology of this condition, the disease is inherited when a person receives two abnormal hemoglobin genes, one from each parent, and during a crisis, the sickled red cells, they block small vessels in the bones, in the chest, in the abdomen, or other organs. You can imagine the kind of pain this person will be feeling when all these sickled cells block all these organs. And the blockage causes severe pain, inflammation, and tissue damage. And triggers can include infection, dehydration, cold temperatures, stress, or low oxygen levels. So there are different types of crisis, such as number one, vaso-occlusive crisis, which is the most common and is marked by pain from blocked blood flow. Then we have sequestration crisis, which is sudden pulling of blood in organs like the spleen or the liver. Then we have aplastic crisis, which is whereby the bone marrow temporarily stops making red blood cells. Then we have hemolytic crisis, which is increased breakdown of red blood cells, worsening anemia. Then we have acute chest syndrome, which is life-threatening, and it involves chest pain, breathing difficulty, and lung issues. So it's just a whole tirade of a lot of things. So for the causes, what exactly triggers sickle cell anemia crisis in individuals that have sickle cell? So number one, infection, cold weather, dehydration, like not drinking enough fluids, stress or emotional upset, overexertion or physical activity, low oxygen, especially in high altitudes, or flying without pressurization, then pregnancy too, and smoking, and also alcohol use. So the symptoms of this crisis, there is severe pain, usually in the bones, chest, abdomen, or joints. There is fever if the crisis is due to an infection. Then there is swelling in the hands and feet, fatigue and weakness, difficulty breathing, pale skin or yellowing of eyes, delayed growth or puberty in children, frequent infections, stroke, or like sudden weakness, and this usually comes in the very severe cases. So other conditions that can mimic a sickle cell crisis, we have bone infections like osteomyelitis, appendicitis, rheumatoid arthritis for the joint pain. The joint pain you see that is experienced in rheumatoid arthritis is similar to the one that is experienced in sickle cell anemia crisis, and in appendicitis too for the abdominal pain. Then kidney stones, pulmonary embolism if there's chest pain and difficulty breathing. So all these conditions have like similar symptoms that we see in this crisis. So for the diagnosis, they get the patient history of, like, just a patient history of this patient has sickle cell anemia, and physical examination during the crisis, blood tests like full blood count, like if there's low red blood cells, this is like person is having the usual crisis. Then reticulocyte count, which shows the bone marrow activity, peripheral blood smear, which shows like sickled cells, then chest x-ray for acute chest syndrome, oxygen saturation levels too can be checked, and they will also do urinalysis and culture if like an infection is suspected, to know the right medications to give. So for the treatment focuses on relieving symptoms, preventing complications, and addressing the cause. So for pain control, for mild pain, we can give paracetamol or NSAIDs like ibuprofen. Then for moderate to severe pains, we can add opioids like morphine that can be monitored in the hospital. Then for hydration, give intravenous fluids or oral rehydration to reduce the sickling. Then oxygen therapy for patients with low oxygen levels, antibiotics if an infection is suspected and based on bacterial culture test results, and then blood transfusion in severe anemia or in cases of stroke or in cases of acute chest syndrome. Then also giving folic acid supplements to support the red blood cells production. Then preventive medications too can be given, like long-term hydroxyurea, and this hydroxyurea is a drug that reduces the frequency of crisis by increasing the fetal hemoglobin. Then vaccines too can be given vaccines against pneumonia, meningitis, hepatitis. So all these preventive medications, and also prophylactic antibiotics can be given in children, especially penicillin. So the management of sickle cell anemia crisis involves long-term strategies to prevent the crisis and monitor for complications. So like some lifestyle advice, like drinking plenty fluids, avoiding these triggers, like avoid cold exposure, manage stress, avoid smoking or alcohol, try to do a regular follow-up with your doctor, and try to go for screenings like for heart and lung assessments, kidney function tests, and try to ensure that you are using the correct medications as prescribed by your doctor or your pharmacist. And it's good for any healthcare provider to explain to the patient like what exactly is happening, and try to educate the patient on how they can recognize their crisis symptoms early so that they can start treatment early. And also counsel for the preventive medications, try to counsel on the proper use of hydroxyurea and the side effects, and also encourage vaccination and regular checkups. So basically, in summary, sickle cell anemia crisis is a painful and potentially dangerous episode seen in people with sickle cell anemia, which is caused by sickled red blood cells blocking blood vessels, and the triggers include infection, dehydration, and stress. And management involves hydration, pain control, oxygen, and treating the underlying cause of the crisis. So I hope I've tried my best in trying to create awareness for this sickle cell anemia crisis. And yeah, it's good that we continue to advocate for sickle cell. And if you know you have this genotype that is SS, or you have the genotype that is AS, like for me, for example, I'm AS, so I know that I should avoid getting a partner that is SS, to avoid my child from having this sickle cell anemia, to avoid my child from having this sickle cell anemia crisis. So if you know you are SS, try to avoid getting a partner that is SS. If you know you are AS, try to avoid getting a partner that is AS. So in all, it's just safer to have a partner that is AA. So if for those who that are AA, it's like you just feel on top of the world, because there's nothing wrong. So, and you don't have to take like the precautions that every other person has to take when it comes to like choosing a partner. So that is basically it for this topic, and I'll see you in the next video. Thank you for watching. Bye.